We now return to Mark Willis and Road Dog Trucking News on SiriusXM's Road Dog Trucking Radio.
Hey, drivers, want to welcome you back. Nice to have you in all across North America. And Dr. Fahmi Farah is on with us now. And, Doctor, it's always great to have you on the program. Welcome back.
Thank you for having me. It's great to be back.
Absolutely. And Dr. Farah, ladies and gentlemen, is one of the nation's leading cardiologists out there, and she really gets into a lot of great research, a lot of good things going on. Tell folks about you and where you are. Welcome back to the show.
Yes, I'm an invasive cardiologist, also the medical director and CEO of Bentley Heart Medical Center and director of Global Health Alliance Foundation.
Okay, very good. Thank you for doing this, and really appreciate you joining me on the show. And February is a very important month for heart health awareness, right? February is a very big month for the heart side. Talk about that. What is it about?
Oh, yes. February is the National Heart Month here in the United States, and it's a month we use to really try our best to raise awareness. You know, heart disease is the #1 killer for both men and women, and so it's worth talking about it and just educating our population so that they can do better.
You know, Doctor, this is also very important to mention here because there's so many different things that are connected with this. There's a thing called broken heart syndrome. What is that? What does that involve?
Yes, it's a very interesting heart condition. It's a condition where, like, the heart function drops, so your pump doesn't work as well. So it's actually a type of heart failure that occurs after, like, a very stressful situation, typically with the loss of a loved one, like, you know, death of a spouse, or even like breakups, like, you know, divorce or like a really bad relationship breaking off. That emotional stress can really damage your heart muscle and can cause the function to go down and actually cause heart failure.
Okay, and how would somebody maybe recognize that they're going through maybe broken heart syndrome? What would be some of the
A lot of times, if it's someone where it happens very abruptly and in an acute setting, they can actually present as heart attack symptoms. So a lot of times we see people in the emergency department coming in with chest pain and shortness of breath. Those would be the two classic signs and symptoms. And so we actually do an EKG, and often on the EKG it shows up as an acute heart attack, like the same signals on the EKG. And so we rush them to the cath lab. We go inside their heart like we would in a massive heart attack situation. And that's how we find out that, no, it's actually not a heart attack. It is, in fact, broken heart syndrome. And, you know, the medical terminology for that is Takotsubo cardiomyopathy, also known as stress cardiomyopathy. So, yeah, the initial phase, if they show up in an acute setting like that, it's the same as heart attack, and that's the protocol we follow.
You mentioned that it's done with maybe a small incision. Is that involving the laparoscopy procedure that you're mentioning, minimally invasive?
Yeah, it is a minimally invasive procedure, so it's called a cardiac catheterization. There are two ways of doing this. One is through the wrist. That's the preferred method. Now that's the latest technology. And the other method is through the groin, and that's a little bit older method. We try to avoid that nowadays. Okay,
very good. And as far as like maybe treating it with maybe a prescription or a chemical regimen, is that maybe treated through that route as well for that?
Correct. So, you know, for this particular condition, once we take them to the cath lab and actually go inside the coronary arteries, we see that it's, in fact, not a blockage. It's not a heart attack. It's something else. That's how we realize that it's actually Takotsubo cardiomyopathy, where the heart function is just dropped and it's not working well. So the treatment for this is medical at that point. So we have certain medications. Yes, it's the same as heart failure treatment. So there are a series of medications that we would put the patient on, and all these medications are very good. The prognosis for this condition is actually pretty good if they're treated in a timely manner. So with time and medications, they can actually completely heal.
You know, Doctor, when you're mentioning this, the fact that you can actually go in and check the heart, maybe check the flow of the heart, circulation, and things like that. My golly, that's got to be very fascinating to see that. Number one, it offers a lot of opportunity for people to get well, get back to maybe a normal stream of life. But the idea of being able to go inside of a heart and look with a camera as an example. That's got to be amazing when you see that every time.
Oh, it is. We do it all the time. It's exciting, and it saves a lot of lives.
Oh, it does, absolutely, and that's the center of what we're all about. The situation as well when somebody is maybe experiencing shortness of breath, or if they are feeling uncomfortable. One might think, okay, the heart is going to be in the center of the chest. That's not true. Correct in that, or am I mistaken about that? In other words, if you feel maybe, say, some kind of a shooting pain in the middle of your chest, is that indicative of a heart attack, or is the heart maybe a little bit maybe towards the left side of the body? How can you tell?
You're actually correct. It does, typical chest pain, it can be on the left side of the chest, but it doesn't have to be. There are many patients I've had where they did not have chest pain on the left side. They, in fact, had it on the right side. Some of them even had it in the back, shoulder, like back shoulder pain or even neck pain. So there are atypical signs and symptoms, and sometimes, especially women, they may not even have chest pain at all. Sometimes they'll just have fatigue, shortness of breath, and a lot of indigestion-like symptoms. Those would be the atypical symptoms, so you should not be ignoring those.
Doctor, interesting you mentioned the fact about women and being treated, say, for heart issues. Do you find that sometimes that maybe women are misdiagnosed, say, by a primary care physician when it comes to maybe diagnosing heart issues going on? How do you see that as far as women go?
That is a very unfortunate fact, and yes, we see that all the time where, especially true for young women, and it's not just with primary care physicians, but also in the emergency department, if they go with chest pain, a lot of times they're just dismissed, not taken very seriously, because a lot of times those symptoms are attributed to anxiety and stress, which sometimes they are, but often they're not. And so when they come back to our cardiology clinic, we do the appropriate testing, and we find that there is something going on in the heart. And the recent statistics and this data shows that a heart attack rate and heart disease rate in general is up in young folks, particularly in the age group of 25 to 43 years. So my advice to all those providers is to please take those symptoms seriously.
Okay, doctor, does this also go evenly across all ethnicities? To say one group may be experience heart issues, say, more than another ethnicity group?
There are some differences, yes. For example, people who don't have access to medicine, for example, the lower socioeconomic group, they can be affected more just because they just don't have access to a healthier lifestyle, and same thing with access to medicine and medical care is just lacking. So, yes, there is a bit of a discrepancy there that we definitely need to work on as a whole.
All right, absolutely. And one more question before we go to the break. Say that somebody is being treated, say in a hospital under the care of a cardiologist. Should the patient maybe ask for things like maybe a list of how to control stress, maybe to cut down on anxiety? Where would maybe somebody find that research? Should that kind of data be made available for folks that have got a high level of stress going on, finding ways to reduce that?
Absolutely. I do think that should be available, and they can find some of that information on sites like AmericanHeartAssociation.org. They have a lot of heart healthy tips. Mayo Clinic has some as well. So there are, credible sources where you can go to find those types of information.
Okay, very good. We got a break, doctor, for just a few minutes. And on a side note, the big game is coming up on Sunday, the Super Bowl, Kansas City and San Francisco. And this got me to thinking about the fact that there's going to be a lot of excitement in the stadiums, in homes, in restaurants, and things like that. And is there a chance, maybe an off chance, and maybe someone who gets really excited about the big game could suffer a heart attack? That would be a terrible thing, but I bet you it does go on. And I want to get Dr. Farah's thoughts on that when we come back out of the break. Big game Sunday. And, you think about the excitement going on. Could you be at risk of maybe experiencing heart trouble? All right, drivers, hey, I want to welcome you back. Dr. Fahmi Farah is on. one of North America's well-known best cardiologists, and very grateful to have her on board. She is in the Dallas-Fort Worth area like me. And, Doctor, again, thank you very much for joining me on the show. Let's get all of the websites, social media, phone numbers where folks can find you guys. Where can they go?
People can find me at www.drfahmifarah.com. You can also find me at Fahmi J. Farah on Instagram and Twitter.
Okay, very good. Thank you very much for joining me on the program. All right, a lot of excitement about the big game coming up on Sunday, Kansas City, San Francisco. The chips are being ordered. The drinks are going to be poured. The screams are going to be loud. People are going to be gathering, and what a game it's going to be. But, you know, I'm thinking about this in terms of can somebody get too excited during the course of the game that they may experience heart trouble? Not to put a downer on the game, but you got to maybe take that into consideration, right, with the big game.
You brought up a very valid point. Yes, anything that's too exciting and stressful, especially in a big game, like it could be sudden stress. It can be bad for the heart, especially for those who have pre-existing heart conditions. They do need to be careful to not get too excited.
Okay, very good. Yeah, I know it's going to be hard to do, or don't get over excited out there because everybody's going to be rooting for their team. What would you recommend maybe for heart-healthy food during the Super Bowl? I know we've got the wings and we've got other things that are going to be there, but maybe throw in a celery stick or two to kind of balance it out?
Yes, so glad you brought up the food part of the Super Bowl. Just like after holidays, like, Christmas and New Year's, we see a spike in hospitalization. It's the same thing after a big game like the Super Bowl. It's usually the day after we see a lot of people coming into the hospital with heart failure exacerbation. This is in particularly those who have pre-existing heart failure condition. And the foods that we typically eat, like you mentioned, wings and chips and stuff like that, are packed with sodium, and they can put a person in heart failure. So my advice would be to stay away from those, and like you said, like vegetables, like carrot sticks, celery sticks, cucumber. Those are all great snacks during the game. Just stick to healthier things, baked fish instead of having chicken wings. Those are typically fried. Maybe bake them, less salt.
Okay, going to say, all right, so it's kind of a checklist. Don't get too excited, and maybe just eat some of the healthy food as well. Doctor, when somebody comes in and they're experiencing, say, a heart episode, and maybe you need to monitor what they're doing on a 24-hour basis, but they're not at the point where they need to be hospitalized, do you put like a monitor on them? I think is it called a Holter monitor that you put on them to watch?
Correct. We have several different types of monitors for different reasons. So if somebody's coming in with palpitations, meaning they're having a racing heart, like their heart rate is going really rapidly, or they're skipping beats, it's just not regular, we would use something like a Holter monitor. And they have different durations, and we individualize this. Sometimes we put them on for 48 hours, sometimes 72 hours, but sometimes we can even put them on for a month. And there are like different variations. There's something called a loop recorder. That's something we actually implant under the skin. It's typically chosen for somebody who needs monitoring for a little bit longer term, usually like a year or two, to catch something. Those would be for your rhythm reasons why we would put those monitors on. But there's a whole different type of monitor now available that are for heart failure patients. It's a little sticky thing that we just stick it on their chest, and it can see how well their fluid is being dealt with by their heart to make sure they're not building up fluid in their chest cavity. That's a very new technology, and we're using that and finding great results with that.
Doctor, the pacemaker has been around for generations. Is that still one of the standards when it comes to maybe regulating the heart flow, the pacemaker, or is that pretty much old technology? No,
it still very much is what we use for those who have low heart rate. So people who have very low heart rate and they're symptomatic from that low heart rate, those would be the patients who are putting pacemakers in. There are other conditions too, like there are certain rhythm problems if their own pacemaker is just not working that well. And there are various different types of heart blocks. Those are called AV block. Those are blocks within the electricity of the heart, and high-grade AV blocks, we use pacemakers for those patients as well.
All right, goodness sakes. All right, Doctor, thank you very much. We always fly through this, and really appreciate you joining me on the program to talk about this. And there are hundreds and hundreds of thousands of listeners to this show every single day, and this information is gold. Golden for them, for the drivers out there, because what I'm hoping it's doing, it is prompting them to action, that the driver's going to talk to their own personal care physician to get the story and find out what needs to be done, because, doctor, it's all about that collaborative partnership that the doctor is forming with that patient. It's a team approach when treating someone for things like heart disorders, right?
Absolutely. I think you made a very great point that it's a team effort between the physician and the patient. But you too, media can help so much by getting the word out, and so I'm really grateful that you have taken the initiative to do that.
All right, absolutely, and want to send to other folks to your website one more time, and I'm noticing that you also do podcasts up on the site as well, which is great. Where can folks find it on the web?
You can find me at www.drfahmifarah.com. And correct, I do have a podcast. It's all about the heart. It is called Queen of Hearts Podcast. And you can find me at Fahmi J. Farah on Instagram and Twitter.
Outstanding. Doctor, very much appreciate you joining me on the show. That is Dr. Fahmi Farah, and she's going to be on every Wednesday with us drivers to give you the medical information that you need. Doctor, let's do this again really soon. I appreciate